Good morning. My name is John Maisie. I'm a financial planner based out of Moncton, New Brunswick, as well as a chartered health insurance specialist and a chartered life underwriter. Today is Monday, April the 20th, and I'm doing a third video on the changes in the pharmacies with regards to filling prescription drugs in the province of New Brunswick. I was hoping not to have to do a third, but here we are. So just to kind of refresh memories, the New Brunswick College of Pharmacists issued a directive on March the 16th to implement a mandatory 30-day maximum refill on prescription drugs in the province of New Brunswick, which took effect, followed shortly thereafter by a state of emergency in the province of New Brunswick because of the COVID-19. The last couple of videos I went into detail explaining how the cost of prescription drugs works, broken down between the component pricing or the actual cost of the pill or the specific medication per unit and dispensing fees. Over the weekend, there's been a lot of discussion online as to the way pharmacies are being perceived and treated throughout this whole situation. I'd like to offer some insight coming at this from several different angles. The first thing I want to address is bias. So every party in this has bias. The end consumer has bias. Their bias is what's it actually costing me in real dollars? What am I paying for my prescription? The plan providers, whether it be an employer, an insurer, or a government, has bias. They're looking at it. What's it costing us? And finally, the last people with bias would be the pharmacy owners. Their bias is, we're delivering this service and we have a cost associated with delivering these services. So when we address the bias aspect of this, we need to understand a couple of different things. They're all intertwined. And at the end of the day, everyone is looking for the same end result. Everybody wants to be able to provide the patient with the actual appropriate product that they need to get through their illness or their ailment. And we are looking at a large swath of the population that will interact with the pharmacy over a period of a year. Currently, 72% of the population is covered under a drug plan. We do have quite a few people that aren't covered as well. That would be the other 20-some plus percent. One of the most disturbing things I've seen with the comments on my video to date are patients saying that they've had no choice but to take their medication every other day. So there's a compliance issue on that. And what I mean by compliance is they're not taking the meds as instructed because they're skipping a day. That is very troubling and very alarming and can have greater consequences than the cost of the actual refills. When we look at the cost of that's being seen right now, the pharmacies and especially the frontline pharmacy workers, whether that be the pharmacist, the pharmatech, the lady at the cash or the gentleman at the cash or anybody in the aisles helping stock the shelves, they're taking an awful lot of heat from the general public because the public is upset that their wallet is being touched. This is understandable. Everybody's stressed at this point in time. And when people's incomes are down and their expenses get up, they're going to take everything a lot more personally. I'd like to ask the general public, though, to please refrain from venting with those frontline workers. They're doing the best they can under extenuating circumstances, as is anybody else that's fortunate enough to still be able to serve in some capacity, whether it be at the grocery store, at the hospital, police, paramedics, coffee shop, what have you. Everybody's trying to get some sense of normalcy, and everybody's on edge. So when the person goes in to pick up their medication, they're seeing an additional cost. So far, we've only been through 1 month of this, which means the people that would have refilled their medications in late 2019, early 2020, or early 2020, would have been the first people to experience the refill protocol. As this drags out, the next batch of people are going to be coming up, those that would have had medications filled in January, February, and then it'll be the ones that were filled in February, March. The College of Pharmacy put a blanket directive out. In my research, there's a website that shows shortages of medications across Canada. It's one used by the trade. And currently, approximately, I think it's somewhere in the neighborhood of 10% of medications are showing some impact of shortage, which means that there's a large percentage that doesn't necessarily have the same impact at this point in time. I've spoken with manufacturers of medications that I deal with through drug reps and pharma reps, and they've indicated that there's potential for longer term issues coming down the pipe because many of the drugs are created offshore in China and India. So if we have supply disruption from being able to get goods from Asia back over to here or Indo-Asia back to here, we could have some bigger issues. I would challenge or encourage the College of Pharmacists in the province of New Brunswick to go back and revisit this blanket policy they've come out with. It should apply in no uncertain terms to drugs that are facing critical shortages. We had a number of drugs prior to the implementation of this policy that were in a shortage situation. I can think specifically of a lot of asthma medications that are in inhaler format. For whatever reason, there were some issues with those, as one example. They need to go back and look at this and say, okay, is this the right approach at this point? Are there some of the drugs that we can free up? So the ones that are mass produced and there's lots of stock on hand, is it really necessary to have them capped at 30 days? Can we be a little bit more lenient on this and go back to the 90-day or 60-day? The pharmacies right now dealing with a 30-day supply are in desperate shape as well because their workloads have essentially tripled. They've gone from filling something on a 90-day cycle to down to 30 days. And all this comes down to math. At the end of the day, they're expending a lot more time and effort to fill these prescriptions in very extenuating circumstances. Their business has been impacted just like ours. We've had to put protocols in place to practice social distancing. We've had extra expenses put on us because of the situation we're in, and we've also seen decrease in revenues as they would have as well. So everybody's in the same situation, but we need to come to a point where we've got everybody pulling in the same direction. So the pharmacy bias right now is they're feeling, the owners of the pharmacies especially are feeling that they're being impacted negatively in public perception because they're making extra money off of this. Well, the fees are the way they're compensated, so we are seeing them make some extra revenue, and chances are it is spent to fulfill the extra needs that are required there. But the perception isn't good. Plus, it also doesn't help their case when they push back on the big bad insurance companies. There's a letter circulating right now within the province of New Brunswick written by a pharmacy owner depicting specifically Blue Cross in this case, saying that they are profiteering with their flat $15 copays. What the pharmacy owner doesn't understand, and this is by me reading this letter, what the pharmacy owner does not understand, I think, is the true mechanics of how drug plans work. So number one, insurers are an administrator in large part for the contract signed with the employer or the government. So if we look at the one he's specifically referencing with Blue Cross, they are the administrator of the New Brunswick Seniors Plan, which has a $15 copay. In this particular instance, with low-cost maintenance drugs, that extra $15 will actually subsidize the insurers, or in this case, the government, as the amount they have to pay out goes down because there's extra monies collected on that copay. But in large part, most insurers are actually seeing an increase in expenses because they're not on a flat $15 copay. It could be a 20% copay. It could be a $5 copay. So in those cases, the insurers are actually paying more. The average cost of a dispensing fee in the province of New Brunswick is $12. So on the $15, you can see that the insurer would save $3 times 2, and that would be money in their pocket. But when we're looking at the 20% copays, it's a much different story. And to paint the insurers with the same brush is not accurate. The other fundamental of insurance, I think this gentleman needs to understand, is that it's not the insurance companies paying this. It's not the government paying this. At the end of the day, it is the stakeholder. The stakeholder at the end of the day is your patient and your patient's employers. Now, to push back on the insurance companies, they're in turnaround talking to the employer saying, can you guys afford to take a bit more of a hit on the drug component on this side? And in many cases, they cannot, because they're still trying to figure out if they can stay viable and stay afloat. So it is a very complex issue, and there's got to be some give here. Now, the other thing I would say to the pharmacists, and this is very big picture, and I'm hoping not to sound alarmist here, but the public will remember how this all was, how they were treated by all of this, whether it be by the insurance company or by the pharmacy. People love their local pharmacies. It's very convenient to be able to go in and chit chat with the pharmacist and the staff there. But the reality is the cost associated with this is not sustainable. In the province of New Brunswick, we're looking at, if this drug out a full year, about $27.5 million in extra fees. This is reduced down to about $6.5 million if we were to be able to go to a 60-day supply. Significant savings. And I don't think we're going to be seeing the pharmacy owners running to the bank with bags of money behind them. I think what you will see, though, is the insurance companies going, okay, if this is going to be the new reality and we're going to be faced with these shortages for the next 12 to 24 to 36 months, we've got to change the way we're doing business. And they may end up going the route as some of the federal Crown corporations have done. My father is a retired civil servant that worked for a Crown Corp, and he no longer has the access to his local pharmacy because the employer, in this case, the one that takes care of the lion's share of the cost of his drug plan, has implemented a mail order drug plan. So now his prescriptions are filled out of a second floor of a building in Dieppe, and his meds are mailed to him as needed. And the dispensing fees on that are significantly lower than what they are on walking into a traditional brick and mortar drugstore. I had concerns with that when it came out because he's losing the contact with his local pharmacist, and if he ended up at the hospital for whatever reason and had to go on a new short-term medication, the local pharmacist would not be aware of his full drug history and what possible interactions are there. But at the end of the day, it comes down to dollars and cents. And right now, the public has very high regard for pharmacies, and they're experiencing a pain point at this point, as are the pharmacies, as are business owners, as are government, everybody else. But the public will quickly forget all the good things if they start to see that their wallet's being touched on a more regular basis. So when the big bad insurer comes up and says, we need to change the way we're handling maintenance drugs, and decides to implement a mail order drug plan, they may not get the pushback that they were expecting from the public, because the public's just going to remember all the extra fees that they had to pay. So there's got to be some give and take here. I'm not saying every prescription should be filled for free in the province of New Brunswick. I'm not saying that some extra pay isn't warranted. What I am saying is we need to look at this and take a pause, step back, and look at the big picture. What are the long-term implications of this if this drags out for a very extended period of time? Now, my own bias, I'm a financial planner. I manage health insurance for several thousand people throughout the province of New Brunswick and several employers. I'm paid on a percentage basis of what the premiums are. If the premiums go up, which is all based on claims, I get paid more. If they go down, I get paid less. I really want them to go down. I'm hoping to get a pay cut, because that means people are healthier, people aren't experiencing the same level of hardship that they had been. And right now it's appearing it's going to go up. Now, the other pushback that we'll get is there are going to be savings to the insurers on the parameds that aren't happening right now. And this is true. But what's going to happen with that is it will work through the system. Some of the national insurers right now, like we've gotten directives from Sun Life and Great West and Manu, that they will be rebating part of the dental premiums and part of the paramedical premiums on the larger groups. With the smaller groups, that will happen, but it will only happen on renewal time. So this will not get back into the hands of the consumer for up to a year. At the end of the day, if this did drag out right now for a full year, and we did experience that extra $27.5 million in fees in the province of New Brunswick, every person covered under a drug plan can anticipate seeing their premiums increase by approximately $5.50 a month per individual. It will get paid at some point. In a roundabout way, the more they pay up front, the less that's going to be down the road. But at the end of the day, we've got to come to a situation or a conclusion here where, the pharmacies work alongside the insurers and the patient and get everybody to understand that everybody's got to give a little right now, and it can't be all one-sided. I feel for my clients that are going from filling 10 prescriptions every 3 months to filling 10 per month and seeing their costs of filling go up by about 200%. I feel for the insurance company trying to figure out a way to make this sustainable and try to figure out a way to help patients. And I feel for the pharmacies because they're on the front line, and when the costs associated with this is made public, they're the ones that are taking the brunt of it and feeling the heat and the hate that's coming out of some people. And unfortunately, there is a lot of hate out there right now, and people are just looking for a way to vent. And unfortunately, it happens to be at the pharmacies. This isn't appropriate. What I've been trying to accomplish, though, is to get the sides to understand that there's got to be something more. There's got to be more to this. There's got to be more cooperation than what's been going on. For the association to come out and say, well, the insurers should waive, and for the province and Brunswick's health minister to come out and say, well, we waive the fees. You guys, the insurance company should waive the fees. And it's to choose your wording carefully, because the fees were not waived by the province of New Brunswick. They were absorbed by the province of New Brunswick and paid for by the taxpayer. Ultimately, it's going to be paid for by the patient through income tax, etc. So it is a very complex issue. And I think there's a lot of emotion in here right now from all sides. But at some point, somebody's got to step back and say, okay, can we get together and figure out a way to make this work better? So the Cosmetology Association, College of Pharmacies, please have a look at that drug list and see if there's any way to tweak your directive and allow some of the drugs that are not in short supply to be refilled either on a 60 or 90 day. To the pharmacies, take a look at the revenue stream, and is there any way you can soften the blow for your end patients? To the government, is there any way you guys can implement some kind of program to maybe soften it up for everybody, where the dispensing fee is subsidized somehow by the taxpayer? To the patient, accept the fact that you are going to have to pay more short term. But let's try to all pull together and all work together and try to get this to be as minimal as possible for all sides. This is not business as usual. We will get through this, but we need to get through it and make sure that everything is sustainable as we do it. There is no free lunch. Somebody's going to be paying for this, and it's just a matter of how are we going to do it. Thank you. Those are my views, and hopefully we can see some positive results come from this as the situation develops. Remember, it's not about what you make, it's about what you keep.